top tier being facilities that can actually provide Ebola treatment to a patient throughout the course of their illness. Initially, there were 3 or 4 hospitals identified across the country who had biocontainment units because of research laboratories nearby. That number has been growing over the last month, and in Washington State, just on Monday, for the last several weeks, there have been 8 different hospitals in our state that leaned into wanting to be Ebola-ready facilities for patient care and have been working toward that goal, and that announcement of those 8 facilities in our state was just made on Monday. We have 1 in Eastern Washington, Providence Sacred Heart Medical Center. The other 7 are in Tacoma, Pierce, and Kane counties, with 1 in Snohomish County, Providence, Everett. So those are facilities that are working really closely at this point with the CDC. They'll come out and do a visit to help assess the level of readiness for patient care, and we'll continue to move forward with that. The next level is all emergency departments and hospitals having the ability to do a solid Ebola screening process to isolate and either continue to medically evaluate through testing or whatever needs to happen, or inform and transport to a facility that could do those pieces. But the goal is that universally across our state and our region is that all emergency departments and hospitals would have that capability to screen and triage. And then the third tier are all the outpatient ambulatory care settings would also be able to be a catchment for doing Ebola screening and referral if a positive screening question came up. So now Helen, to clarify that, because we've gotten a lot of questions actually when we announced about these 8 hospitals, what does that mean for other institutions and clinical settings? And so this still remains the goal. Erica, what arrow do I hit?
Just click on the PowerPoint presentation. Just click anywhere in there, and then you should be able to arrow over with the right pointing arrow.
Thank you. So it is about identifying, isolating, and informing. Identify, setting up systems to do screening, ideally through a phone screening process. Our 911 dispatch and combined communication center here in Spokane have already incorporated a whole set of protocol questions into any call that they get for EMS response. Receptionists or appointment schedulers, a lot of organizations have added questions to those. Somebody calling for their annual checkup, there's a whole set of questions that they're still asking, even though you're calling to go in for your annual, take your child in for your annual well child check. But they're adding that screening component. And then there's also the screening then that needs to happen if people walk through your door in urgent cares or other environments. The screening questions, if they receive a positive, then the goal is to quickly get them into an isolation situation, a private room, ideally with a private bathroom. There's dedicated equipment that's already been identified, and only essential personnel that have been pre-designated to enter the room after appropriate PPE, and then medical evaluation process continues. And then informing, knowing in your internal protocols in terms of who you need to communicate with if you're evaluating somebody that's answered positively on some of the Ebola screening questions. And then ideally, knowing who your partners are in the community, particularly public health is going to help with some of the coordination role around specimen shipping for Ebola testing, knowing what the nearest facility is that can do a higher level of screening or evaluation or ultimately care, and how that patient's going to get from point A to point B. And then there's the phone numbers and how the 24 contact process that should work. And then finally, this is just to give a really high overview of the types of activities that we collectively as a community, healthcare community, public health included, have been working on since Thomas Duncan arrived in Texas. And there's so many topics that we are working on. Monitoring, being able to monitor travelers or others who may have had an exposure to an Ebola patient. What does isolation and quarantine look like? Providing education to a whole bunch of different partners and sectors of the community. Managing the messaging and the media. We really, as public health, see the media as one of our best friends and have a relationship with them in that manner. It doesn't always work to our favor, but 99% of the time, actually, we have found that it does, especially when it comes to issues that are serious around the health of the community. We've been working with EMS Transport on their protocols, the death care industry. There is guidance around how human remains need to be handled, and not all funeral homes are totally comfortable with that. So finding those that are and working with them to make sure those services are available across the community. Dealing with the hazardous waste from Ebola. Specimens shipping, as I mentioned already, in the Ebola-ready hospitals. And our land borders and our sea borders are part of that border control and traveler screening process. These are all just, these partners and more are the partners and processes that we've been working on either in a coordinating role with public health or in the role in bringing people together with our healthcare system. So with that brief introduction about how we as a healthcare coalition fit into all of this, I have the pleasure of introducing Dr. Carrie Jones. She began her medical career via a Gulf scholarship to Oregon State University, where she then recognized her future to be in pediatric medicine, and subsequently went to Oregon Health Sciences University to obtain her doctorate in medicine in 1998. While there, she married and had 2 wonderful children. Her next step was to the University of Nevada School of Medicine in Las Vegas for her pediatric residency, followed by the beginning of her hospitalist career at Sunrise Children's Hospital, also in Las Vegas. After 4 years in Las Vegas, she then spent a year in Montana as a pediatric hospitalist intensivist before moving to Spokane. She joined with Providence Sacred Heart Children's Hospital as a pediatric hospitalist in November of 2006. Her husband is originally from Portland, so they're very happy to be back in the Northwest. Dr. Jones began her mission work in Spokane with Samaritan's Purse, providing medical relief missions to Kenya, Haiti, and most recently Liberia. Through her work, she has supported responses to cholera outbreaks, earthquakes, and most recently Ebola. Welcome. Thanks. Okay. Which speakers are this one? We'll just talk to this. Excellent. All right. Well, thanks for coming, you guys. I know you didn't come to hear me talk about Ebola, so I'm just hopefully I can make this entertaining and interesting and thought-provoking. Everyone's consuming Ebola, and I'm not sure we're consuming the right parts of it personally, but we all have to make these decisions. So I give lectures a lot, but not to normal people. So there's always objectives when I give a lecture. So I'm just going to tell you what I'm hoping you guys get out of this. I'm so bad at it quicker, but okay. We have a great response plan here in the U.S., but why have so many people died in West Africa? We're going to talk about that. We're going to talk about what the culture there has done to cause so many people to die. That doesn't happen here. I'm going to try to give you a cautious, common sense approach to Ebola, and then show you some pictures of appropriately putting on PPE, which is that personal protective equipment. And really, I want to leave a little anxiety. I don't know if you guys are anxious or not, but boy, this country is anxious. Y'all make sure. It's kind of, so Africa is huge. Okay, some of these are really blurry. I apologize.
the audience know about our sound. And then I'm also,
You can do whatever you like.
okay, sorry to keep.
So, big, huge country, bigger than the U.S. Lots and lots of countries. Hang on, next slide. Okay. These are the countries that have had Ebola at some point. Mostly Central Sub-Saharan Africa, where Congo, Uganda, Gabon, and then South Africa a little bit. That's where the normal small outbreaks have been that we've always heard about, and then they flare up and they go away. The Congo just had one, and it ended. I don't know if anyone noticed that. We had it in West Africa, and then Congo had a different strain. MSF, Doctors Without Borders, came in, they controlled it, it's gone, it's done. But they have flares once in a while. So currently, it's just that little top left corner, those three countries. Oh, sorry, okay. I'm going to talk about Liberia, because that's where I was. It's also, and you guys might know this, you might not, it's the only U.S. colony in Africa, which is why I think there's some sense Liberia to start their own country. And about 1845 or so, they actually had their own country. It's kind of interesting. Harriet Tubman's grandson was their first duly elected president for 30 years, which is a little different political system than ours. And they did really well then. Unfortunately, as in most African countries, after he was done, there's a lot of people that thought there's a lot of unrest and coups, and then they led to a civil war, and it was a horrible civil war. I mean, the country was a democracy, it was growing, it was great. If you look at that, 1 million people were affected by the civil war, out of, at that point, about 3 million. So currently there's about 4 million people there, and they have a democracy under President Ellen Johnson Sirleaf, who's a 76-year-old woman who's won the Nobel Peace Prize, and who's very bright, but who wasn't prepared for Ebola. But that's where that country has been and where it is now. So if you think about a country that started to grow and then was shattered, the Civil War shattered everything, so they had nothing left. Oops, I gotta get back to this thing. Okay, so if you're in Liberia versus the U.S., you're 12 times more likely to die in infancy. You're going to have 2.5 times more babies, which I was surprised that wasn't higher, actually. You'll die 21 years sooner. You're going to use a lot less electricity than exercise. You'll make a lot less money, so less. 99.9% less spent on healthcare. And that's not just per person, that's like the whole country. You don't spend much money on healthcare in Liberia. And you know the saying, you get what you pay for. That's kind of what's happening. So in a country of 4 million people, there's 90 physicians, 1 psychiatrist, 1 internist, 2 pediatricians, and 3 OBs. And those are Liberian physicians. There's a lot of expats or people that don't live there that move in there to help that aren't part of that number. And then there's nurses and midwives, and there are PAs, but I couldn't find any numbers from the PAs. So that ratio is 1 doc for 53,000 people. In the U.S., it's 1 doc for 400 people. And we still cannot get into the doctor when we want to. Isn't it infuriating? Okay. The latest numbers I saw were from the 2,800 people who died in Liberia. 1,100 in Sierra Leone. Liberia, by the way, the number of new cases has decreased to about 20 a day. Sierra Leone is still going up, and Guinea's decreased too. Sierra Leone is where it's kind of out of control right now. And you can't do this. So 324 healthcare workers out of 570 or something, have died. So out of 570 infected. So oh, no, no. Okay, I would do sign language, but I don't know. Okay, so the real question is, and you're going to think this is easy. Why is it so bad in Africa? Well, it's easy. It's a poor country. It doesn't have all these things. Yes and no. As we go through the things, I want you to notice how the opposite is here in the U.S. Okay, because that's going to be your reader. And then I want you to notice how busy each slide gets as I go from the easy to the more complicated. So, they don't have healthcare workers. Okay, so if you have a bad disease, that could be a problem. Okay, but after taking care of people with Ebola, you don't really need trained healthcare workers as much as you would think. This is a big one. Lack of protective equipment for the healthcare workers. So they're seeing patients, and then they're getting sick because they're not protected. So then you're losing them. So see the cycle. It's not good there. That's pretty simple. This one, you don't have clean water, you don't have electricity, so your facilities are nothing sterile in Africa, let alone clean, but kind of thing. So you would think that might be a problem, but in Ebola, that's not, because bleach exists. So honestly, you throw some bleach on any bomb or diarrhea or whatever, and you've killed the virus, and so being clean isn't a problem. So the fact that they're poor and don't have electricity, not really playing a huge role in why so many people died. This is a big one. And as public health people, who I applaud you, because I thought public health was really simple, and then as I started to look at more and more things, I realized, like these slides, each one gets more complicated the more you learn, the more strict it is. So kudos to you all. They don't have county health departments that can help. They don't have state health departments. They have a Ministry of Health that has a few people in it that don't know what to do when something like this happens because they don't have the resources. They're smart people. They just don't have resources. So those are the easy things. Now remember, they had a civil war. They had different leaders telling them things. They were getting killed by all different sides. They don't trust anybody. They barely trust this Nobel Peace Prize winning president that they have. So now you have this disease that is killing people, and a lot of the population didn't believe the disease was real. And they said, if you go to these treatment centers, they're going to kill you. You will not come back out. I can verify this. I saw them protesting and starting things on fire because we were trying to kill them. We know that's not right, but that is what they honestly believe from after what they've been through. The vice president's physician died of Ebola at our treatment center, denying until his death that Ebola existed. Now, why he became the treatment center, nobody really understood that, but he clearly had some illness. He knew he was sick, malaria, typhoid. He wasn't sure. This is what they all were, but he was in there telling people that would come to the window that this is not Ebola, do not worry about Ebola, don't freak out. And then he died from Ebola. That's proven. It's Ebola. Africans don't have this basic medical understanding that we have. So if I tell you this is a virus, it's contagious, you know what that means. You will not touch me. You will not, you wash your hands. Well, A, they don't have a place to wash their hands. B, what is a virus? How do you explain this to someone who doesn't know anything about biology or microbiology, or how to spread things? So that causes problems too, especially when you have people that don't trust you. And then I was thinking about this as I wrote this slide. Has anyone been to Africa? These are the friendliest people in the world. You cannot go somewhere, everywhere you go, they shake it. Every day you go to work to shake your hand. I came back from Kenya and I went to work and I said, I'm going to shake everyone's hand because it's such a nice way to start the day. I did it for a day and everybody thought I was crazy and I didn't do it after that anymore because then we see every day. But in Africa, they are that outgoing. They love you. They just love people. So to tell them not to touch somebody, that's crazy. What is wrong with you? That's crazy. And then when someone dies in Liberia, that is the most precious time of their life. They just died. Everybody loves them. They're going to come show them how much they love them. They hug them. They kiss them. They are just horribly sad that they died. And that's normal. And it's incredibly rude if you don't do that. The most contagious you ever are with Ebola is when you die. That's when the viral load is the highest. And so when you tell people, don't touch people, don't touch dead people, well, grandma just died. We all have to come say goodbye. It's a disconnect. It takes a lot of education to get them over that. So that was a big problem early on. And then not just distrust, but fear. People that seemed to think they were sick would go in to get treatment, and they wouldn't come home. So why would you go in to get treatment? Why don't I just die at home? Okay, and then to make it a little bit worse, people started to realize this was real. Ebola might exist. The radio song that says, Ebola, Ebola, don't kiss your friends. They played over and over and over because that's their mass media. They don't have TV going everywhere. They don't have radio everywhere. They have radio, but they don't have radio. People started to realize it, and they decided maybe they should get treatment. Well, then there was no place for them to go. I was in the Monrovia, in the capital, at the only Ebola treatment center, which had 22 beds. They were trying to build Ebola 3, I'll explain this later. And the rioting was going on and fires were going on, so they couldn't build it because there were people not letting us build it. And so people would want to bring in a sick one, and we couldn't take them. We actually were pulled out. And that continued to happen because so many people were sick. So many people realized, wow, if we keep this person, we're going to get sick. Let's bring them somewhere. And then they get turned away. So then you take these incredibly contagious people back to their homes to get more people sick. There are 3 big hospitals in Monrovia, and all 3 of them closed for about 2 weeks, right when I was there, actually, after I got there. Because too many of the healthcare workers had been sick with Ebola. They didn't have healthcare workers. They didn't have protective equipment to keep the people even in triage and the ER safe from people coming in. They were not trying to treat Ebola. The goal was that every Ebola patient would go to an Ebola treatment center, not to a hospital. You don't want to mix an Ebola patient and a hospital patient. You just don't do that. But they had to be lost to people. So for a week and a half to 2 weeks, you could get no medical care in Monrovia. If you're delivering a baby, good luck. If you had an infection, good luck. There was nothing. You can never see that happening here, but that happened. That's how bad it was, and there was no beds. It's just insane. It's insane. So the healthcare workers were the first ones that had the huge death toll. People would come in because they're sick, they didn't know they had Ebola. Healthcare workers might have gloves, maybe a mask. They'd take care of them. Then they would get sick. At one point, out of the 22 beds, I believe 15 were healthcare workers in our Ebola treatment center because we were early on. I was there at the end of July, beginning of August. And so when healthcare workers are the ones dying, it's hard to get more healthcare workers to come and work. I mean, who wants to do that? I mean, people from America, we're not flocking to Liberia to go work with Ebola. And it makes sense. Until you can guarantee someone's safety, which obviously you never can, but until you can do that, they were, and you can't blame them. All their friends were dying. Let's see. And then the healthcare itself. I know we complain in America. I mean, I'm a doctor. I complain all the time about healthcare in America. It wasn't really healthcare. It was very minimal at best. It was very rudimentary. A friend of mine saw something on TV and said, how come we're not using any fluids? And I almost lost it on her. I'm like, you have no idea, actually, what's going on out there. To actually have IV stuff, the time to put it in somebody, the ability to go back and wash the bag and move it over, and have people comfortable poking people, and then having them not lose blood wherever they're, it just, you can't fathom it until you're there. And yet she hadn't been there. She was just asking a simple question. But IV fluids have been proven to help so much. They were aborted for about a month in Liberia because nobody could do it. They didn't have the staffing to do it. That's changed. That's gotten better now. And that's why people in America, I think that's a huge part of it, is that we can actually combine healthcare here. The healthcare there is bad. Okay. And then this is one that makes me saddest, and I want you to read the last part. People that had to take their family members home. So think of a family member. You know they might have Ebola. You don't really want to get it. You take them in. We're sorry, we don't have a bed. You have to take them home. Oh. And we're not going to give you anything to go home with. Just try not to get sick. That was a huge problem. We've come a long way, and a lot of things that are going on in Liberia now are like giving PPE-like stuff to the family members, making sure they all have bleach. There was a run on bleach in Monrovia. They went up tenfold in price. They actually then made a law to not allow bleach prices to increase because of Ebola. I mean, everybody makes a buck, even in Monrovia. But so now we're trying to educate families on how not to get it. But for the first couple months of this, none of that education was there. These people would just have to take their members back home, and then pretty soon you see more family members dying. And when you look at who died, it's always clusters of families. Mm-hmm. It's not someone that was on the subway that gave you Ebola. It's the family member that you took care of when they had active secretions and vomit and diarrhea coming out of their body. So that was really bummer. So that was the setting when I got there. That's Kent. I'm sure everybody has heard of Kent and Nancy. They were the two first Ebola patients from America, but they're in Liberia. Kent, I never actually chatted with. I helped take care of him and evacuated him. Nancy, I spent a lot of time with. But a delightful man. That's one of the typical houses at Ebola. I work with Samaritan's Purse. It's a Christian mission organization run by Franklin Graham. And one of their big branches is World Medical Missions. And they recently started this disaster assist relief team. And so I'm hired for 2 years, and they can call me and say, hey, can you go somewhere for a couple of weeks because we have a disaster we need a doctor on. And if I have time, I go. And if I don't, I don't. For some reason, God gave me 2 weeks off in August. I had no plans for it. And they called me in June and said, are you free in August? And I said, yes. So that's how I got to Liberia. Not something, perfectly honest, I had no desire to go to Liberia. None of you should have a desire, I think, to go to Liberia. But I'm willing. That doesn't mean I was excited. MSF is Medicine Sans Frontières, which is Doctors Without Borders. MSF is way easier to say, so everything's MSF. MSF they are the gods of Ebola. They have managed every outbreak that has occurred in Africa. They know how to take care of themselves and take care of their patients. And honestly, anything we do in this country that does not mirror MSF, we're just kind of, I don't know, that's probably not the smartest thing to do. MSF, though, was overwhelmed. It's better. A lot more aides come in, so it's not bad now. They asked, or I don't know, Samaritan's Purse offered, I don't know. We were going to take over 2 of the treatment centers. So on that map of Liberia, there's Monrovia, which was the capital, and then up north, right next to Guinea, is a place called Foya. And Foya was a wonderful treatment center. They had protocols. They had things set up. They had the Liberian staff taking care of everybody, and we would go in and help a little bit. That was great. Monrovia was just getting going because I don't think I explained this well, but the reason it hasn't expanded before in Africa is that it was in little rural areas,
MSF could go in, they could say, oh, is this family member, who did you contact, and we stop that, we don't spread it, and it stops. Unfortunately, with modern technology, there's now roads and ways for people to travel all about between Guinea and Sierra Leone and Liberia, and people would get it, not know that Ebola existed, someone might die, but they had left, so they didn't know. And then all of a sudden you spread it to the capital, and that's when, Monrovia, that's when it went out of control. So the treatment centers in Monrovia were not nearly what Foya was. This is my favorite slide. I just laugh hysterically every time I read this, because this, like, I almost want to go to the Ebola Center if I have Ebola. I feel like it's fun. You will receive good, healthy food and treatment for other diseases. That's sweet. We gave them rice and beans, and it was not necessarily more rice and beans. It was just whatever we could get out of the little pot, and we give it to you with a spoon, and you were too weak to eat it, but we didn't have time to feed you. But we give you rice and beans, so that was your good food. You can call your family on your phone. That's true. If your phone dies, there's no electricity anywhere in the little place where we have you, so you can call them till it dies. If you have fever, diarrhea, or vomiting, go to the nearest health facility. You will be welcome to receive good care. Unless there's no beds, then they send you home. Last. And then up here, your family members can visit you and bring you food. They can now. In the newer centers, they can. They couldn't when I was there. It's the saddest thing ever. But the beds are comfortable and the fan will keep you cool. I never saw a fan. That's just like, who made this poster? And then if you're covered from Ebola, you have no more virus if you join your family and community. You cannot transmit Ebola to them. That's true. Unfortunately, if you survive Ebola, you're one of the few in your family that did. And people are not, again, no medical education. They are looking at these Ebola survivors list now. You're kind of weird. What is wrong with you, and should we trust you? And they're not being welcomed back into the communities, even though they would be a great health resource and they could donate blood, which would probably be helpful. So keep that in mind. That's the idea of a perfect treatment center. And they're getting closer. I really like that. This is the nicest, the closest that they've come. This is ELWA 3. ELWA is Evangelism Loves West Africa. That's what the acronym is. It's a community that's been in Monrovia for 50 years. And so they started at ELWA in the chapel. ELWA is one of the 3 main hospitals. And then they moved to ELWA 2, which is where I was. And then ELWA 3 is this big one. It's a big tent. You see, they all have a bed. They all have a bucket. This man is in triage. He has a bucket for vomiting, diarrhea, and what they'll do is they'll sit there and someone will then come and ask him the questions and screen him to see if he's a suspected case or not. And if he is, then he gets put into the suspected part of the treatment center until his blood tests come back to confirm or not confirm. If he gets confirmed, he moves to the confirmed section of the treatment center. All of those sections are full PPE, but triage is not, because they think about this as we deal with Ebola maybe in this country. Triage is someone maybe with gloves and a mask, and they just ask questions and they talk to them. Don't touch them. That's how you get it. Don't touch people. There's the food. That wasn't ours. I don't know what he's scooping it out of, but he's just dumping beans and rice into the bowl and you take the rest around. This one's a hard one for me. Over 5,000 people have died, and in America, it's 5,000 people have died. In Africa, they all have a name. Even though it's not like here, it's not an electronic record, they all have a name and it goes on a little whiteboard. That's what the name is. And where they might be. So you can't see this one, but it would be suspected, and then the names of the people there. I swear they all were Surly because their last name is Surly. And then confirmed, and then where I was, there was confirmed extension because they filled up the confirmed area. And then when you round or sign out, you go through all the patients by name, and when you round, they had names. And it's just so sad here because we're such good individuals in America, and that's one of the best parts about being Americans. Everybody is important. And they are there too, but it's very different. Next you have a social worker too. That poor guy, he would spend all day just trying to find family members and tell them how the patient is because they weren't calling their families. They didn't have phones. One teenager had a phone, but nobody else did. He was very busy man. Cleaning is a huge part of Ebola. Remember, bleach kills it. I know all of our protocols have bleach wipes or soap. I am a huge believer in just the 0.5% bleach hand washing and spraying everything. They're making bleach back there, transferring it. This is the boots. So the boots and the aprons are reusable. When you're in Africa, it's good to reuse things. So bleach and sunlight will kill something. So after you step out, you rinse out the dump the boots and the bleach, and you hang them upside down and they dry in the sun. And then you use them again. The gloves are the gloves that sanitation people would use for cleaning. This is what the newest treatment center is looking like. I mean, it's going to be as close to that one I showed you as possible. And honestly, that would be fantastic. People So excited. So this is where I was. This is the confirmed extension area. And I'll try to quickly tell you a story. I didn't get to do a CISM when I came back, the whole, what's it called? I forget what it stands for now. Yeah. And I didn't do the debrief. Samaritan's Purse offered all of us to go to Atlanta and have this big debrief. Well, actually, they wanted us all to go somewhere safe for 3 weeks so the country would be freaked out that we were back. And then come back for a debrief. And I didn't do it. I just came home. This was a bad day. The last day at this treatment center, I'm going to go to this picture. I'll look at this for a second. Because this picture says so much. The librarian staff refused to come to work. So Ella 2 had 22 patients, and Samaritan's Purse with the librarian staff at the night shift said, we're not going to accept any patients, but we don't have enough people and we don't have any beds. And this room, this is the room that the day I was there, this room had 6 patients in it the day I was there. And it's an extension, so it's just this big room that was outside. The other rooms are these little cells, that I swear it's like a little prison. Concrete walls, little windows like that. And so each one was in their own little cubby, alone, with nothing but a bucket and a bottle of water, and then their cold dressing days. And that's where they spent their days. So we get in, and 2 of us were there. Nobody from Liberia showed up. There was a fight going on in the main office between the Minister of Health and the doctor from the overnight shift because they were trying to bring 4 people in, and he said they would have to miss. And it's an appalling argument. I mean, personally, I think, well, it's probably safer for everybody to just pile them all in there, and then it's probably not safer for your healthcare workers to just pile them all in there. So we just went and started to work. But there was only 2 of us. 3 more people came, so that there were actually 4 of us that could wear PPE for the day. Which this is rough. You put the PPE on, like this guy has on. It is so hot. It's already 80 degrees there, and it's the rainy season, so it's just humid. And once you step in, you cannot come back. So you step into the suspected area, and you're supposed to break it up into shifts. So we were going to do the suspected area. There's 5 patients. And you go, the first one went in, the guy has all over the ground. There's a bucket, but it's hard to get the bucket. And he could barely sit up. So we sat him up, we gave him some water, we gave him this malaria pill, his antibiotic, and Tylenol. That's our health care. I'm not sure it takes a doctor to do that, but that's what we did. We then poured bleach, tried to first pour bleach on the vomit. And then we squeegeed it out, hoping someone would come to work sanitation. Nobody came that day to work sanitation. Again, healthcare workers were frightened. Went, a couple more rooms were just like that. And then we went to a gal who I will never forget, poor thing, laying in diarrhea that was bloody and just miserable and in pain. And she had an IV, and so we got them to throw a bag in. Because you can throw stuff in from the outside. You just can't take anything out, so they would toss something in if we did it. So we tossed the bag and hooked it up, and her IV went back. And we told her, poor thing, that the next group rounding would put her IV back in. Nobody ever saw her again that day. I doubt she lived until the next day. And she was so, it was just sad. And when I was leaving, we stood her out, cleaned her up. I was leaning over her to give her a drink of water, and a drop of sweat fell off of me and landed on her. And it's just so selfish, but I was a little freaked out. I thought, whoa, how come things are going through? But it turns out you can sweat so much under the hood that it'll come out from under the hood and come out below. It's a little freaky. So then there was that one more person, and then my partner and I decided we would just deliver rice and beans in the next 2 sections because we'd already been there for an hour, and we'd let the next group that came through do the next section. Again, nobody came through. It was bad. So she went to, anyway, I went to this section back here, and when you don't expect something, there's a door here about as wide as this table. And I ran around the corner with some rice and beans, and there's a dead man naked sitting in the doorway. And it's like, oh. And then right behind him on top is another dead man that we didn't know died. There were 6 dead bodies. We knew there were 4 when we went in to start, but there were 6 dead bodies now. And then there was 2 women on a cot to the left, and one was bleeding from her mouth, and all she could say was, please help me, please help me. And all I could say was, here's your rice and beans, and here's your bottle of water, and someone's going to be coming. I mean, it's just surreal. It really is. And if I sound callous, then I can say it, so it's because it's, I don't know, because it's just the way it was. So then I walked out of there, and I don't know, my heart rate was at least 140. I stopped to count it, and I was like, I probably need to get out of here. It's about 90 minutes on the stars. So they got sprayed out. and went back to where we found out that 2 more people, so Kent and Nancy had Ebola. That had been found out 2 days before. One of the doctors that was taking care of Kent had a temperature of 104. So he was now being isolated while they waited to test him. And then up at Toya, that other camp, that other center, one of the nurses had diarrhea and they were isolating her. So all of a sudden, on this medical crew that was probably 12 people total, there's 2 that have Ebola and 2 that are now isolated. And so people were freaking out. To put it mildly. I'm going to brag. I wasn't freaking out. I was just thinking, wow, Lord, what are you doing here? So the next group that was supposed to go in didn't go in. And Samaritan's Purse called down and said, we are pulling you all out. And so this is really the last image I have I want to, because we left as a Liberian doctor and a PA were coming in. And they were going to do a round. And then he was telling 4 young men how to wear PPE because they were going to go in and take care of the bodies. Remember, the most contagious you ever are is when you just die. And he's sending 4 teenagers in that have never done PPE, telling them how to put them on and then what to do with their bodies to go pile them up in the morgue. That was fun. Then we left. And this is what, you walk outside from that dark room, and look, it's sunny and bright in Monrovia, and you don't have to think about it anymore. It's just bizarre. And it is, it's beautiful Monrovia. It's right on the coast. It's got great surfing. It's beautiful. So that was the part that you see little images on in Google. This is what I did the rest of the trip, and I'll try to be fast. I don't want to keep you guys forever. This is Nancy's house. So all those buckets are bleach for the hand washing, and then we finally had the other bucket. We filled it up enough to put aprons in. And then that's her front porch, and that was our supply stocking area. That's everything we needed is on that front porch. I spent more hours on that front porch than anywhere else in Monrovia because I suddenly went from being a doctor to being a pediatrician with 5 adult medicine doctors and 2 adults to take care of. So I became a sanitation person, which is funny because I know more about donning and doffing and cleaning than anybody that I know. That's all I did. That's me. And that is me the day before we left. It's the day we evacuated Nancy. And this is the coolest sprayer ever. I didn't suffer. Hello, I'm an I had sprayed everybody, and I have to bend over, pump, 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 and I spray, pump, pump. And then I got this thing, and I could pump and spray as I walked along. It was amazing. You had to be there. But that was by far the highlight of my trip. In fact, it was coveted. There were only 2 of those pumps. This is the group. There were 11 of us left behind. So there were about 40 people that Samaritan's Purse had there. They evacuated them out in a stepwise process over a couple days, and for some reason they asked me to stay behind, which I thought was silly because I wasn't doing medicine, but apparently when you're the only one that knows how to make bleach and how to spray, they like you to be there, so they asked me to stay. And then everybody else left. So there were 11 of us that cleaned up Kent's house and then took care of Nancy, which means someone gets dressed, goes into Nancy's, gives her whatever IV if she needs it, talks to her, feeds her, makes her some food. They stayed in their home, so their home was the whole treatment center. And then someone would be outside in case they broke containment. So if you're inside and you rip your glove or something, that's called breaking containment, and you have to come out, and so you don't want someone to be inside alone. And so that's why I was on the porch for hours and hours, because one night she got the antibodies during the whole night, and so someone was in there all night long, so I had to stay and get people in and out all night. And that in and of itself, the antibodies that they were given were originally sent to Sierra Leone for the poor virology doctor that passed away. MSF had the antibodies. They couldn't decide if they should give them or not. They'd never been given to a human before. They thought ethically, is this the right thing to do? We can't go through that process like we do in the States where we get permission and consent and people know it. And are we experimenting on somebody if we give it to him? And they chose not to give it. And he died. And I don't know that he would have given it, but he died. So Samaritan's Purse found out, and they said, well, we'll take the antibodies. We'll give them to our people. They didn't say it like that, but so they found a driver guy, someone in Sierra Leone, picked it up in this cooler. I have a piece of the cooler. That's my only piece of history. That was packed in about 20 little ice packs of dry ice, and carried this cooler over to Guinea, got on a canoe, crossed the river into Liberia, where our pilot, the Samaritan's Purse pilot, flew up to Poya, which is at the center, picked him up, flew him down. The whole time, we never let go of this cooler. Brought it in, gave it to Lance, the guy in the blue on the right, who's in charge of everything. and was done with his job. I don't know if they threatened his family or if they paid him a ton of money, but he did not let go of that. So then we had 3 vials of antibodies, and you're supposed to go to Nancy because Kent got blood earlier in the day from someone who survived, the first survivor at Ebola. Unfortunately, we thought the antibodies, we're getting ready to give them to Nancy, and Lance pulled up because Kent was crashing and they thought he was going to die, which was really the only stressful time. After we left Elwa, Kent and Nancy weren't real stressful. They were sick, but they seemed to be compensated. I mean, they got tons of IV fluid. They got most of the stuff that we would do here, and they were doing pretty good. But Kent got really bad. He spiked higher than he had. He was vomiting, or having diarrhea and vomiting. He was blooding out, and he thought he was going to die, and everybody else thought he was going to die. And so it was a little bit of stress. So they took the antibodies from Nancy and brought them over to him. And if you've heard him talk, he thinks about 2 to 3 hours after this started, he was a whole new man. So this was a Thursday night, thought he was going to die, got the antibodies. Friday night, he gets evacuated, and he walked from his bed to the living room, put on his own PPE, and then holding someone's arm, walked and climbed into the back of the truck, which was the ambulance to go to the airport. It was amazing. I mean, it was amazing, actually. So I'm kind of a believer in something, either the blood that he got or the antibodies that he got. Nancy got the antibodies as well, and then she got the rest back in the States. And as you know, they both did fine. So it's a fascinating whole time. Okay. And then after we got them evacuated, they decided to get us out. So they had this 73-year-old jet, the DC-3. And I guess we were happy to leave. It's hard to explain. But the joy that everybody had every day when they were getting evacuated, it was so selfish in a way, and yet, boy, it's like, I survived, I'm going home. Unfortunately, you're going to come back. I forgot the health department, but you're going to come home. So that was fun because one of the guys gave blood to Nancy, and it's got about 14,000, 15,000 feet high, and he got so lightheaded, and it was freezing in the plane. But we got out. They flew us to Ouagadougou in Burkina Faso, and they didn't know we were going to land because nobody wanted us to come. Like, nobody wanted people from Liberia to land a plane in the country. So we landed there, and Linda, the gal on the right, speaks French. She was raised on the Congo. And so they let us stay in their airport for 5 hours in this little corner, and then they let us get on our flight to Paris and leave. So we got on later. Okay, so now we're talking about PPE, because you hear that term all the time. Proper PPE means that you have nothing showing, period. I mean, it's really simple. So Tim here volunteered to let me take his shirts and got dressed. Tim actually started wearing shorts, too. He was at Foya, and we just wear his underwear because he gets so sweaty. The first time I sprayed him out, I was a little surprised. Then he decided, since there were all these women around, he would wear shorts. So he had shorts on. You put your boots on first, you put the PPE suit on. And suits are all different. Then you put on gloves, your first layer of gloves. And what we did, these suits have a little thumb strap, so you don't have to tape it. But if you didn't have this suit, we would duct tape, and you duct tape over the sleeve, but not onto the glove. So you put the glove on, the sleeve is over it, and you tighten the sleeve down over the glove. It's different for the second pair. And then you put one mask on. And then you put the hood on, which has a mask on it. And most of the people would, I didn't really mind it, but they'd tear the outer mask because the first mask would be too constricting if it didn't. So then that's why they have the hole in the mask. And if you tie the hood right, you can get just little tiny eyes. If you tie it the way you think you should tie it, you get these big eyes, and then you can't cover everything. Then you put the goggles on, and then my job is to make sure nothing is showing, that everything's tucked in, there's no skin anywhere around your eyes. Because remember, it's spread by liquid, and it's liquid that gets in your mucous membrane, and so your eyes and your mouth and your nose are very important. And you get things on our hands, and we touch your faces. And, so the hands and the face, that's what you really have to protect. Let's see, and then you put the apron on last and the second pair of gloves. So the second pair of gloves, you actually take the glove to the sleeve so that it forms a barrier there. And then the apron is just to keep the whole front of you, because if you get diarrhea or vomit or something, you can stop it from getting on your actual gown. And the apron's for use. And that's the door of Nancy's house. And you can see bleachers had a rough hole on the bottom of her door because they would stand in there to get sprayed out. So then that's the one in full PPE. And then I don't have pictures taking it off. And honestly, I barely have any pictures because it wasn't really a picture-taking kind of event. And I just didn't think of it whenever I was anywhere that might be interesting. So the most important thing about doffing, I don't know why we don't say taking it off, but doffing PPE. And this is where you're going to get burned. This is what I worry about in America, because I think everybody's pretty good at, oh, I'm going to protect myself. But then are they patient enough, and as a doctor, are we patient enough to take it all off appropriately? I don't know. Look at how many times you hand wash. And I'm not sure what it is. The policy at the hospital, I think it's like a week twice, but I don't know. But you either have a sink, not sink, a water bucket, and you turn on bleach, wash your hands, or you have someone spraying, which is what we had at the house. So I would spray the hands completely, spray the body, turn around, spray the whole body, and then spray the hands again. You could never do the hands too many times. And this is with 2 pairs of gloves on, spray that. So then you take off your first pair of gloves, so the outer duct tape comes off, take your gloves off, wash the hands. You're always washing the hands. Take off the apron, put it in the, if you're able to, put it in the bleach to reuse. If not, it goes into the garbage. Wash your hands. Then you have a bend like this, and take the goggles off this way. You don't just stand and take off goggles like this. You get out of the way so that you can lift and go forward, and then go right into either the bleach if you're going to reuse them, or into the garbage. Wash your hands, because you just touched something that's dirty. Because think about this, every time you're touching something, just take it off. Change the dirty. You wash your hands. Then you take off the lid. Same thing, you bend forward, pull the lid out. Goes in the garbage. Wash your hands. The gown is hard. If you're not very coordinated, the gown is really tricky. So you spray in front of the gown, you unzip it, spray it again, spray your hands. Then you shimmy as much as you can, put your hand in, and you only touch the inside of the gown. You don't touch anything on the outside of the gown. Inside, push, 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 get it down, push, push, pull it over so maybe you get an arm out, pull it around, same thing on this side. It's tricky. The first time you do it, it takes forever, and you're just so excited to get out of it that it's frustrating, but it gets better after time. You get it down, get into your boots, you step on it, you pull it out, on your left now, it's your mask, gloves, your boots. Wash your hands again. Even though you didn't touch anything on your gown, wash your hands again. Then you will bend over, take your mask off, wash your hands, take your gloves off without touching, so you have to take gloves off, yeah, without touching your hands, or the glove, the outside of the glove. And then wash your hands again, and then your boots get sprayed on the front and the back, and then you step out. We would have to turn around backwards, spray the boots, and then you step out, spray your foot, step out, and then there's a bucket, short bucket of bleach water, and you go stand in it, and you boots for a little bit. And then you step out, and you go sit down, take off your boots, and go wash your hands at the sink, or not the sink, at the bottom. It's a process. It's a long process. It goes pretty quickly, but it's an important process. They think Nancy got Ebola by decontaminating correctly. And I know I had 2 people to decontaminate the first time it came out, and the local guy that was doing it, oh, it was horrible. But thankfully, Ian, one of our expats, was there, and he said, whoa, whoa, and walked me through it step by step. It's not something that I recommend people doing the first time you, like, don't do it for real the first time you do this, which unfortunately I did. I found out later that NSF has a 3 to 5 day training period, which is another reason they pulled us out, because we hadn't been there very long, and the most trained person in the center had been there for 4 days, so they decided to probably not get so smart. Okay, finally, Ebola here. Don't panic. Okay. I'll go through this quick, but think back to why this is a problem in Liberia. They don't understand medical issues. We do. We are well aware of what Ebola can do. No concerns there. We sort of believe what the government tells us. I mean, we're skeptical. There's politics, there's that sort of thing. But if the government says, this is contagious and you should do this, we're probably going to do it. Poor Mr. Friedan at the CDC, everything he has said has been true. Some things probably weren't done as good as they could have. And so you start to wonder, does he know what he's talking about? But he really does. He's telling you. We can share information like that. Social media, TV, radio. We can tell someone, do not go to this spot, and nobody will go there in 2 seconds. You can't do that in West Africa. And then we have health departments that can trace and follow people. That is the key. Sick people spread Ebola. People that are just getting sick with Ebola don't spread Ebola. And that's so important. And if you hear nothing else, remember that. If someone thinks they have Ebola, and they're talking to you and telling you they have a fever and then they're going through the symptoms, they might have Ebola. But they are not spreading Ebola where they're going unless they're vomiting on you, or they just vomited on somebody else, or they just pooped on you, or they spit on you on purpose. It is not, and we shall know that from Duncan even. He exposed a lot of people. Nobody got sick, but the people that took care of him, he was the most sick, when you're the most contagious. It is actually hard to get Ebola, sort of, and yet it's a bad thing. And then we have a place to isolate people. Hello, look at the plans that we're making. You might have Ebola, you are isolated immediately. You will never come out of it until 3 tests are negative. And then we have equipment for healthcare workers. The bigger question is if people know how to use it appropriately. And then if you do get admitted, we have great healthcare. Despite the complaints we might have about healthcare, you're fine in America. Fantastic. But look we've had 2 deaths. The man that just arrived last week, that really wasn't in the news much. It's kind of dying down, but he was flown over. He was really sick when he got here. And I'm pretty sure, I don't know for sure, that on Duncan, they did extreme things, that I'll talk about in a second, that I don't know if that's so wise, like intubating and dialysis and that sort of thing. If you have an Ebola patient, they're either going to probably survive with supportive care or they're going to die. And these extreme measures, this is probably the first time anything that extreme has been done for someone with Ebola. They didn't work. And so hopefully that's teaching us that the risk that you're putting your healthcare workers under for the gain is probably not the smartest. And then Americans, if you tell us not to touch someone, we won't touch anybody. There's no problem in our culture to don't kiss the dead person, don't, so we can do that. But still, cautious common sense is my theme with Ebola. So yes, use common sense, but be cautious. Because if you do get it, and it's a horrible disease. It's horrible. I've seen it. It's horrible. You don't want to die that way. If you think there is a real threat of Ebola, your safety is more important than that of the care of your patients. Okay? And Ebola is not like a shooter situation where things happen quickly. Ebola is never something you need to rush. Okay? If someone's going to die in the next 10 minutes from their Ebola, if you don't do something, they're going to die. It's that simple. So if you think someone has Ebola, then do what needs to be done in a timely manner, but not in a hurry. Don't cut any corners. Like I put, this isn't the flu. You don't just get this and suffer for a few days and then get better. And this I don't think is, I don't know. You guys, I love how people have worked together in this country to make a plan for Ebola. I seriously doubt it will ever have to be used, but the way people are communicating and planning, I love that. I think those are, someone was saying that before, that's huge that we can do that and plan for it. And if we don't plan, something will happen. So it's fantastic that we plan. But the onus for the work, I would think, would be on the county health departments. When I came back, Sandy from Stevens County called me every other day just to see how I was doing. Nobody knew I had been in Liberia. Like, Spokane, see, you didn't know you were a threat because nobody didn't tell you I was here. But you weren't at risk because I wasn't sick. And like most people, I knew I was in Liberia. I knew I'd been exposed, so I knew what to watch for. And anybody flying back as a healthcare worker knows that. People that might live in Liberia coming over, I'm not sure what they know. So I'm a little nervous there, and I like that we're aware of where people are. So that contact tracing is huge. And then I'm hoping, and I saw that there's one number to call. If we just make it easy on people, that's what we need. I might have an Ebola patient. I'm going to call this number, and you can just tell them step by step. Just don't touch them. You can talk to them. And you can talk to an Ebola patient. If you had Ebola, we're fine. Even if I get a couple of feet closer, we're fine. Even if I get right next to you, we're fine until you vomit on me. Then I freak out. But alas. Okay. And then just some opinions, because I don't know how you go to Liberia and not get opinions when you come back. As you're planning things, do things simple. So as the departments are planning, if you have something set aside as a transport and just gut it out, we used a pickup truck. We put some wood frames in the back and a tarp over the top. And then we pulled a mattress pad in the back, and they climbed in and they laid down in that. We gave them a bucket with some bleach in it, so if they got sick on the way to the airport, they could vomit in that. And then we just closed the tarp, and that was our ambulance. And boy, you saw our fire. We were done. We just pulled it all off, sprayed down the truck, and burned it. We were done. It's that easy. No equipment needed. I mean, people with Ebola, again, they don't come in typically, especially in this country, when they're about to die. They come in when they're walking and talking. They can drive somewhere if you want. Have bleach. Nothing. I have bleach everywhere. I talked to the fire department, and it's really stressed bleach because it kills Ebola. It's actually good for your hands. My hands have never been as soft as they were after coming from Liberia. I wash my hands 1,000 times a day in this bleach water. Someone had bad psoriasis, and she's like, I don't know, it went away. It's fantastic. But if someone vomits, spray the bleach. If you had a patient you thought had it and you transported them, you need to clean behind, just spray the bleach or wipe down bleach. Bleach is your best friend. And then whoever's in charge, make sure you know when you need PPE. If you're just talking to somebody, you don't need PPE. If you're driving the ambulance, you don't need PPE. If you're going to touch a patient or be in close proximity where a patient could get things on you, you need PPE. And make sure you know how to do it correctly. If you're cleaning up after someone, you should wear PPE. And I think that gets left behind. We're talking about all our healthcare workers and training and wear PPE. But who's going to clean up after the patient? or when they vomit or they have diarrhea or they are out of their bed and they move, those people need to be protected too. Let's see, make sure you were right. And then this, I think my last one. Above all else, as we saw the healthcare workers get decimated in West Africa, protecting healthcare workers. I'm not saying that because I'm a healthcare worker. I'm saying if you don't protect them, you're not going to have any healthcare workers, and then the patient care gets worse. So whoever's setting things up, make sure that you've done it in a way that minimizes risk. And then when you're taking care of them, ethical questions come up. How far do we go? Do we intubate? Do we do CPR? Do we do dialysis? Or do we say, boy, we're going to let you go because you're going to die anyway, probably, and we're not going to expose all those people. If you're an emergency responder, just die as you are, prepare for the unexpected. And if you're worried about Ebola, cover your eyes. Again, people think masks and gloves. Okay, but then we always touch our face, and the eyes are huge. It's a huge target to get stuff in. So if you're talking to someone, just wear your mask and put some glasses or goggles on, and that way you'll keep your hands out of your eyes. And this is just my opinion. I've told Sacred Heart this. I know that the designated center here, and such is life. If someone has Ebola in this part of the country, I hope we can triage them as quickly and with as few people as possible and get them to a facility that is actually ready to dedicate their time and energy to do Ebola. Like I said, you don't want to do, in West Africa, you don't want to do Ebola and medicine at the same hospital. You don't want healthcare workers crossing over. You don't want the publicity of having one part of your hospital with this deadly contagious virus. And you don't want people that don't know what they're doing going in to clean up and take care of patients. And if you are prepared, it's great, but it's a lot of work. I mean, we had 4 people rotating 24/7 on one person in Liberia. We don't have that luxury here. They talk about putting in 2 people at a time for 4 hours. Yeah. They talk about things that sound pretty wise, but it is a lot of work. I'm not sure how safe it is. So that's just my opinion. Take that for what it's worth. But as you're planning things, keep that in mind. That the garbage stacks up, the debris stacks up, the number of healthcare workers exposed stacks up, the number of people that then get 21 days off stacks up. And then if something bad happens, it's like, oh, what happened? And then, so, anyway, I don't know why any hospital would want an Ebola patient. Like, I can't imagine why you'd want an Ebola patient. And then it's not all bad news. People are starting to survive. And it is so exciting for them when they survive. And they're starting in Guinea to do studies to take survivors, take their blood, and give it to people who have Ebola because there's antibodies in it. And it's probably should be great. Mm-hmm. And that's Ian. That's the guy that sprayed me out. And that's this little family of kids and he's sort of touching on that quiet, that would come and sing the Ebola song for us every day. This was out in front of Nancy's house. So that's really, I think that's great. Like it's almost 2:30. So any questions or comments? And I love comments because I love hearing people talk at the grocery store about Ebola, and I just go, wow. Yeah.
If you're okay with it.
And we'll touch on that here in a little bit, but the whole session here is being recorded, so that will be available on our website, on the HCC website, in the road, down the road a little bit, and we can also make the PowerPoint presentation separately if it's okay with Dr. Jones. We can make that available too.
Yeah, the docking of the PE, is that like in that specific action laid out anywhere?
Yes.
Yes. Well, I have to say, like, Secret Heart has it's a 12-page protocol. I have a 1 sheet for both. It's just, and I gave it to them, and I gave it to anybody. It's the MSF. MSF, I'm just telling you, MSF has done this. They know how to do it right. So it's donning and doffing. But yes, the states have done a ton of work. I mean, I am amazed at how much has been done for Ebola, and I don't doubt that we're going to be well prepared for someone comes in with it. But it's not something you want to do the first time. So I know they're doing training at Sacred Heart. But did you have a question?
Oh, now that they weren't sure why some people didn't go over the sort of contact happening. Have they figured that out? Or?
You mean in West Africa or here?
Well,
like I guess so like the doctor.
Can you repeat the question? Repeat the question.
Sorry.
Yeah, thanks.
The question is, people weren't sure where they were getting Ebola. Some people that had gotten it haven't figured out where they got it. I can speak about Aunt Nancy, I think. Nancy thinks she got it in the decontamination process. Kent thinks there was a PA that wasn't very sick who kept working at a different hospital because they would work at 2 hospitals, which again, you don't want to mix your hospitals. And so, well, at the normal hospital where they weren't treating Ebola, but there was a risk of Ebola, they were interacting, and he thinks he got it from that PA over there who ended up dying from Ebola, but wasn't sick with it before. I don't know, the guy that came back from MSF, I don't know that he knows where he broke contain or how he got it. But remember, the safest you are is when you're in full PPE. It's when you're out on the street or when you're in West Africa, not in America, but people, although people don't touch anymore in West Africa, you don't know who next to you has Ebola. I mean, I was in a house with 8 people, and every day we come home, and there were some really paranoid people. They would bleach the toilet every time. I mean, it was great, and there's bleach water everywhere. And again, unless you're sick, you're symptomatic, you're not contagious. But if someone doesn't tell you they're symptomatic, then you wouldn't know. So I don't know that we'll always know where people got it. It's pretty easy to figure out though on the patient, but that was usually family member.
Pretty easy.
Yeah, but they don't have contact tracing. I mean, that wasn't happening. It's happening now. There's so many CDC people and a World Health Organization doing that now. It's very helpful. But before, that was not hard. Just trying to find a place to put these people was very hard.
Well, they say, are they such things sweat area?
Yes, what can you? It's a food.
So shaking hands.
Shaking a sweaty hand and someone who has a fever right now with Ebola, I would never do that. No. I touched David's, this freaked me out a little, Nancy's husband, David. So they're married, right? She has Ebola, and he goes from, bye honey, I'm going here to, oh, you have Ebola, I'm never touching you again, until she was clear. I was putting on his, or I was helping him take some, I don't know, and he had a sweaty head, and my hand touched it. And I was a little freaked out for a second, and then I said, wait, he's not sick, it's okay, it's just sweat. But yeah, sweat can do it. But alas, anything else? All right, well thank you guys.
Thank you very much.